Good morning, everyone. Thank you for coming today. Today is a monumental day in New England in the fight against the unrelenting opioid epidemic. For too long, this epidemic has not only ravaged communities across the country, but in particular has had a devastating effect here in northern New England. New Hampshire, Maine, and Vermont have been especially hard hit by this epidemic. Currently, based on AMR data, the number of overdose deaths in the first quarter in New Hampshire's largest communities, those being Manchester and Nashua, has increased over the past 3 years. The data shows that in the first quarter of 2020, there were 160 overdose, followed by 166 such overdoses in 2021. And in the first quarter of this year, we see a rise of approximately 35% to 255 overdoses. I don't have to tell anybody in this room that we have all seen the impact of this crisis. We have seen firsthand family, friends, and community members struggle with addiction. No one, I say no one, has been immune from this scourge. Too many lives have been lost, and too many families have been shattered, whether that be in Berlin, New Hampshire, Brattleboro, Vermont, or Bangor, Maine. It doesn't matter the state, it doesn't matter the city, it doesn't matter the community, it doesn't matter the family. Thus, we must all work together to marshal our resources to curb the flow of opioids into northern New England. And today, ladies and gentlemen, is a testament to our dedication and our collaboration, as we are here to announce the deployment of another powerful resource in this ongoing battle in the opioid epidemic. I am truly honored to be joined by my federal partners here today, Assistant Attorney General Kenneth Polite of the Criminal Division of the Department of Justice, U.S. Attorney Darcy McElwee of Maine, and U.S. Attorney Nicholas Carest of Vermont. We are also joined by our federal law enforcement partners, Deputy Inspector General of the Department of Health and Human Service, Christian Schrank, FBI Acting Assistant Director of the Criminal Investigation Unit, Aaron Tappan, and DEA Administrative Assistant Kristen O'Malley. But we cannot do this alone with just our federal partners, and so we are also joined by our state partners, Deputy Attorney General James Buffetti of New Hampshire, Assistant Attorney General John Burke of Maine, Senior Assistant Attorney General Tom Warboys, who oversees the Medicaid Fraud Unit in the New Hampshire Attorney General's Office, and Assistant Attorney General Elizabeth Anderson of Vermont. We are here to announce the formation of the Department of Justice New England Prescription Opioid Strike Force, also, as you will hear it called, NEPO. That is going to be formed here. It will be housed here in Concord. Assistant Attorney General Kenneth Polite will provide more detail about NEPO and the mission of the strike force. It will focus primarily on medical providers in New Hampshire, Maine, and Vermont who are illegally prescribing and hence distributing opioids into our community. Various federal resources have focused on drug dealers who pollute our communities. But now with the NEPO strike force, we have an additional tool, a tool that will also look at the opioid crisis, but from another perspective, the illegal prescribers. The strike force is a shining example of the ongoing and outstanding collaboration between federal and state partners, while we work to one common goal, to stop this epidemic and to protect the citizens in northern New England. Lastly, I would like to say that I am truly grateful for the department that this unit will be housed in Concord while serving the communities of northern New England. It is now my distinct honor and pleasure to introduce Assistant Attorney General Kenneth Polite, who oversees the Criminal Division at the United States Department of Justice.
Thank you so much to U.S. Attorney Young, specifically to you and to your entire staff for the wonderful welcome and the warm hospitality on our visit. I'm proud to be here in Concord, where I have the distinct honor of announcing the formation of the Department of Justice's New England Prescription Opioid Strike Force. Now, as we all know, the opioid epidemic continues to plague many areas of our nation. In the last year alone, more than 75,000 people across this country lost their lives due to opioid overdose. And be clear, its effect cannot be measured solely by the tragic sum of lives lost. You see, every day, millions of people struggle with the painful repercussions of their addiction, and millions of families, including many of our own families, are living with the heartache of those consequences. This is an epidemic that has many causes, and we must continue to be just as expansive in our response. Prevention, intervention, treatment, and counseling all are critical tools, and our enforcement efforts must include combating gangs and violent crime, as well as illegal drug production and trafficking, both domestically and abroad. But the NEPO Strike Force will help to address one of those root causes: the unlawful prescription and diversion of opioids. Now, I make today's announcement just over 3 years after the creation of the department's Appalachian Regional Prescription Opioid Strike Force. When I began as the head of the Criminal Division, I asked our fraud section to identify the data, study the data, and identify where we should replicate our strike force model. Today, we are gathered here because the New England area was the clear answer. We are expanding our efforts here because these communities have been particularly devastated by this epidemic. In recent years, some of the greatest spikes in overdoses, overdose deaths, and aberrant opioid prescriptions have all occurred here in the New England area. The NEPO Strike Force will build on our past success, bringing together the resources and expertise of the Criminal Division's fraud section, along with our U.S. Attorney's offices in New Hampshire, Maine, and Vermont, and our law enforcement partners in FBI, DEA, and HHS OIG, along with our state and local law enforcement partners. NEPO will combat illegal prescription opioids and healthcare fraud by holding accountable corrupt medical professionals who seek to peddle opioids for profit, often at the expense of the lives of the women and men here in the New England area. Now, let me be clear. I know that there are many medical professionals who are diligent. They are law-abiding, and they do their very best for their communities and for their patients, including the appropriate use of prescription drugs for pain management. To those healthcare professionals, you have my thanks, and we welcome your partnership. But our focus is on those medical professionals who violate their oath to do no harm and exploit vulnerable patients who are struggling with addiction. We are focused on those who seek to profit from patient addiction and are contributing to the plague of opioid abuse and overdose, too often with deadly results. To those rogue actors, the NEPO Strike Force is here to ensure that your criminal conduct comes to an end. And by doing so, we seek to attain our ultimate goal of reducing addiction and saving lives here in New England. Thank you all for being here. I now turn the podium over to our U.S. Attorney for Maine, Darcy McElwain.
Thank you, AAG Polite. Good morning. My name is Darcy McElwain. I'm the United States Attorney for the District of Maine. We have offices in Bangor and Portland. On behalf of the entire District of Maine and the state and local law enforcement communities with whom we serve, I am honored to be here today to begin a critical partnership with the New England Prescription Opioid Strike Force. We are grateful to be included in the region covered by this impressive initiative, which will provide essential resources to combat a growing epidemic. Maine's opioid overdose death rate has skyrocketed in recent years. The people of Maine are losing loved ones at an alarming rate, and Maine's entire law enforcement community has identified the opioid epidemic as the #1 issue its officers are dealing with on a daily basis, with limited resources and staffing in nearly every department across the state of Maine. Officers are exhausted physically, mentally, and emotionally from the daily experience of trying to help and save so many individuals struggling with substance use disorder. They are surrounded by death and loss daily. While the growing issue of the trafficking of illegal drugs in our state, in particular fentanyl, is well publicized, according to state statistics, nearly a quarter of drug overdose deaths in Maine in 2020 were the result of pharmaceutical opioids. And in fact, many of those who died from illicit substances very likely first tried pharmaceuticals either on their own or for those from a friend or family member. The District of Maine is grateful for the opportunity to address the deadly practice of overprescribing and diverting opioids through a collaboration with this strike force. Staff from our office will be working closely with criminal division attorneys and our law enforcement partners on cases brought in the District of Maine. We are hopeful for a swift and meaningful impact in our region. Thank you. At this time, I'd like to turn the podium over to the United States Attorney from the District of Vermont, Nicholas Karrast.
Thank you, U.S. Attorney McElwee. I'm Nicholas Karrast. I'm the U.S. Attorney for the District of Vermont. It's an honor to be here with all of you today to announce the kickoff of the NEPO Strike Force. Vermont has been a poster child for the opioid epidemic. Indeed, we made the cover of Rolling Stone magazine and were called America's heroin capital back in 2014. Unfortunately, since that time, overdose deaths in Vermont have continued to rise. In the first 3 months of 2022, there have been 43 overdose deaths in Vermont. And in those same first 3 months of 2022, 10 Vermonters have overdosed and died directly from prescription opioids. That means roughly 1/4 of the overdose deaths in Vermont so far in 2022 have been from opioids prescribed by a trusted professional. That's the bad news. The good news is that law enforcement throughout Vermont has made the opioid epidemic a priority. In the U.S. Attorney's Office, we're lucky every day to work with our great partners at the DEA, the FBI, HHS, HSI, ATF, the Vermont State Police, and numerous state and local sheriff's departments. With this great collaboration, we have taken a multifaceted approach to the opioid epidemic, including vigorous prosecution of drug traffickers, commitment to supporting treatment, including by participating in 2 types of federal drug courts, and partnerships with non-law enforcement agencies to address the needs of those in recovery and those who are striving for recovery. As we know, addiction often starts with a prescription. Indeed, when witnesses or defendants in our cases describe their path to substance use disorder, too often those paths have started with an on-the-job injury or a sports injury that was treated with opioids. We also know that the vast majority of doctors and healthcare professionals adhere to their oath to do no harm. But just like in any profession, there are a few bad apples. There are doctors and healthcare professionals who violate the trust that their patients put in them. This violation of trust makes crimes committed by healthcare professionals overprescribing addictive narcotics especially odious. Collaboration with the NEPO Strike Force will enhance the resources of our small U.S. Attorney's Office in Vermont to investigate and prosecute doctors who violate the law with their prescriptions. In Vermont, we pride ourselves on our hub-and-spoke treatment model for those suffering from addiction. We have been held up as a national model. The Howard Center in Burlington and Jenna's Promise in Johnson are just two examples of Vermont entities making a positive difference. We can't allow the few bad apples to tarnish the great reputation and excellent works of responsible healthcare professionals. The NEPO Strike Force will help make sure that doesn't happen. In Vermont, we see the NEPO Strike Force as the next step in our ongoing effort to combat drug crime and drug addiction, and we are excited to participate. The NEPO Strike Force is an opportunity to directly address the 10 prescription overdoses, 10 Vermont lives lost that we have seen already this year, and to try to prevent more cases of addiction that start with a prescription. I would now like to introduce Deputy Inspector General for Investigations, Christian Schrank of the U.S. Department of Health and Human Services, Office of Inspector General.
Thank you, U.S. Attorney Karest. I would like to commend my colleagues who are here today for your unwavering commitment to ending the opioid epidemic. The Department of Health and Human Services, Office of the Inspector General, is proud to be a part of the newly formed New England Prescription Opioid Strike Force. This strike force will play an integral role in our efforts to stem opioid addiction, an epidemic which continues to plague American families and communities. More than 75,000 Americans died last year from a drug overdose, and millions of people are currently affected by opioid addiction. Overdose rates in the New England area are among the highest in the country. Drug addiction has touched many of us personally through our families and communities. Unfortunately, some healthcare providers who put personal profit above patient safety play a large part in prolonging and exacerbating the nation's opioid epidemic. And it is the patients and their families who pay the price for that greed. HHS OIG is dedicated to putting patients at the center of our work by investigating and bringing to justice those healthcare providers who participate in illegal activity and endanger the health and well-being of their patients. Our dedicated team of investigators work tirelessly to detect, prevent, and mitigate opioid-related fraud, waste, and abuse in HHS programs. And the NEPO Strike Force will do just that. Bring federal agencies together to curb the unlawful prescription of opioids. Today, HHS OIG is proud to reiterate our commitment to holding those bad actors accountable. I would like to thank the Department of Justice and Assistant Attorney General Polite for making opioid-related healthcare fraud a priority. The hard work and commitment of the various strike forces, such as the Appalachian Regional Prescription Opioid Strike Force, have been instrumental in preventing further patient harm. HHS OIG looks forward to extending these successes to the New England region. This hard work would not be possible without our partners at the Department of Justice, the United States Attorney's offices, the Drug Enforcement Administration, the Federal Bureau of Investigation, various state Medicaid fraud control units, and numerous state and local law enforcement agencies. Today, I'd like to also thank the Vermont Medicaid Fraud Control Unit, New Hampshire's Medicaid Fraud Control Unit, as well as Maine, for coming today to be a part of this and to continue to work these cases together and jointly. I'd like to thank the dedicated women and men at HHS OIG, our special agents, our analysts, our digital investigators, who work tirelessly to safeguard the health and safety of Americans. Their commitment to rooting out fraud, waste, and abuse in federal health care programs is invaluable, and we thank you for what you do day in and day out. To those affected by opioid addiction in the New England region and across the country, have discussions with your healthcare providers about care and treatment. If you or a loved one is seeking information related to treatment for substance use disorder, please contact the Substance Abuse and Mental Health Services Administration National Helpline at 1-800-662-HELP, 662-HELP. Also, as the Assistant Attorney General said earlier, we rely on the public to inform us. If you know of healthcare providers, pharmacists who are committing opioid-related fraud, please reach out to our hotline at 1-800-HHS-TIPS. Thank you. And at this time, I'd like to introduce Assistant Administrator of the Drug Enforcement Administration, Christy O'Malley.
Thank you, Deputy Inspector General Schrank. I'm pleased to be here today with my colleagues from across the United States government to demonstrate our shared commitment to using every means possible to end the opioid epidemic in this country. At this moment in the United States, when we are losing tens of thousands of lives every year to opioid overdoses, many of which are here in New England, DEA's top priority is using every tool possible to save lives. DEA is proud to join our partners from the Department of Justice, HHS, FBI, and many state and local partners to form the NEPO Strike Force. This strike force provides the opportunity to expand upon the work that DEA agents and diversion investigators have already been doing in this region, and that is to hold medical professionals accountable for fueling the nation's opioid crisis through drug diversion and fraud. When a patient walks into a doctor's office, that patient has every right to expect that the doctor is putting the patient's best interests at heart. Sadly, here in New England and throughout the country, too often we are seeing that doctors are putting their own greed above the interests of those patients. We at DEA stand here today to send the message that our agents and our investigators will work zealously throughout the region and throughout the country to pursue those who illegally distribute prescription opioids for their own selfish gain at the expense of a patient's safety and well-being. At the same time, DEA fully supports expanded access to medications used to treat opioid use disorder. We want such medications to be readily and safely available to everyone who needs it. We know that there are many doctors dedicated to providing those medications to patients every day, and we commend them. DEA has partnered with HHS and other federal agencies to use multiple tools to expand that access. DEA's work to help those who have been harmed by drug trafficking and relentlessly pursue those who cause the harm has never been more critical. Right now, in the United States, an American is dying every 5 minutes from a drug overdose or drug poisoning, and many of those are opioid related. We must do everything in our power to stop this alarming trend. We are stronger if we do this work together. That's why I'm thankful for the Department of Justice, for the U.S. Attorney's offices, for our law enforcement partners in the region who have come together to form the NEPO Strike Force. We want to build on the success of other strike forces around the country where this model has proven to work. I would like to thank our partners for joining with DEA in this important initiative. And finally, I would like to thank the women and men of DEA who work each and every day tirelessly to make our communities here in New England and across the country safer and healthier. Now I'd like to introduce FBI Acting Deputy Assistant Director Aaron Tapp.
Thank you, Deputy Administrator. Good morning. My name is Aaron Tapp, and I'm the Acting Deputy Assistant Director of the FBI's Criminal Investigative Division. I'm honored to be here this morning to join with our partners for this great announcement, our partners from the Department of Justice, HHS, and DEA, to talk about the FBI's support of the New England Prescription Opioid Strike Force, or NEPO. I would venture to guess that nobody in this room, not a single person, has not been affected personally or knows somebody who's been affected personally by the opioid epidemic in this country. This issue is personal to me, as I know it is personal to many of you. You've heard the statistics here today. More than 75,000 people in the United States lost their lives due to opioid overdose in the last year alone. Think about that. That is nearly double the population of the city of Concord. This crisis does not discriminate, impacting the young and the old, the rich, the impoverished, our sons and daughters, sisters, brothers, mothers, and fathers. And it does so with devastating and unrelenting force. Communities across the country and in this community have felt the impact of that force and experienced the devastating loss that is of life that is so often accompanies this epidemic. So, we must match force with even greater force and strength and momentum, which can only be generated through shared commitment and collaboration like what you're seeing here today. Our objective is not only to help those who are already in the throes of addiction, but also to help prevent others from reaching that point. As Assistant Attorney General Polite stated, the NEPO Strike Force will help address one of the root causes of the opioid epidemic, the unlawful prescription and diversion of opioids by corrupt medical professionals and others. The NEPO Strike Force will investigate all healthcare fraud schemes in the New England region and will seek to identify medical professionals, including doctors, nurses, pharmacists, and others who are engaging in criminal conduct. The strike force will focus on those medical professionals who place a greater value on the profits that they can earn than the well-being of their patients. Simply put, the NEPO Strike Force will seek to root out medical professionals who profit from the addiction of your families and your neighbors. We have made much progress nationally, but there is much more we have to do. The formation of this task force highlights the FBI's commitment to do whatever it takes to impact the opioid epidemic across this nation. Thank you to all the law enforcement agencies, the Department of Justice, the United States attorneys from New Hampshire, Maine, and Vermont who are here today for their commitment to working collectively to bring justice to those who are illegally prescribing and profiting off of addiction. Finally, as this task force effort begins, as Christian said, we need your help. Many of you know which doctors are overprescribing opioids in your communities. And by doing so, they are perpetuating the cycle of addiction. You can make a difference by partnering with us. Please call us at 1-800-CALL-FBI or reach us online at tips.fbi.gov. to report prescription opioid diversion in your communities. The FBI stands ready, willing, and able to work with our law enforcement partners on the NEPO Strike Force to protect this community from the destructive effects of healthcare fraud and prescription opioid diversion. Thank you.
And now we'll open it up for questions. If you could please keep your questions related to today's announcement and identify yourself and your media affiliation. Are there any questions?
Toss with New Hampshire Public Radio. Could you provide some specifics on the number of prosecutors that are going to be assigned to this program, or even a dollar value? What is the federal government investing in this legislation?
Absolutely. Thank you for the excellent question. The initial investment in terms of number of prosecutors will be 4 prosecutors. A number of them are already on the ground. We are already making cases. And we also know that there is a number of additional investments that will be made from the law enforcement side as well.
Do you have a dollar value what the program might cost at the moment?
We can get you some specifics related to dollar values. I think it's also important to keep in mind the impact that this has in terms of the prevention of additional diversion of pills onto the streets, which results in millions of dollars of dollars saved by this effort.
Adam Sullivan, WCAX. I apologize for being late.
No worries.
Can you describe how this illegal prescribing and profiting works, and how, if any, will pharmacies
Certainly, we are, and just to be clear, when we talk about medical professionals, we're talking about pharmacists. We're also talking about physicians. We're also talking about dentists at times, along with assistants that work in terms of those healthcare environments. I could talk just briefly, if by comparison or analogy, to the ARPO strike force, where we've already arrested over 100 defendants, conviction of over 60 of those defendants at this point. Examples of the types of cases that you see there range from medical professionals selling pills out of a parking lot in exchange for sex, no legitimate medical purpose for those distributions. You have the conviction of a physician, for example, who was barred in one state, crossed state lines, lost track, the state regulators lost track of that individual. He was able to continue to prescribe and overprescribe with no legitimate purpose. Millions of pills being spilled out into the streets of that community. That's an individual that we brought to justice as part of ARPO as well. These are not gray areas. These are not medical professionals that are walking close to the line at all. These are the worst of the worst in terms of individuals that are responsible for opioid prescription pills being poured out onto our communities.
Mark Hayward, New Hampshire Union Leader.
Yes.
Two questions. So this is the second task force of its kind following the South London. Isn't this Johnny come lately? We've had an opioid crisis now for 5-6 years, and it seems like the professionals were the initial cause of it, but now it's gone on to, fentanyl, which comes from illegitimate sources.
So our healthcare unit actually has 15 localized strike forces in places like Miami and the Gulf Coast. This is the second regional such strike force. The first, as has already been referenced, was in the Appalachian area. It covered multiple states. And so this will be following in the footsteps of that regional model. So just to be clear, there's a significant amount of resources that we have invested from the department's perspective. In terms of this being Johnny come lately or perhaps a little bit delayed, I know that these are U.S. attorneys' offices and law enforcement agencies that have been on the ground here in this community fighting this fight for many years. What we are hoping to do through this strike force is to amplify those efforts, to hopefully ensure that we are able to bring to justice more medical professionals that are responsible for this type of epidemic, where opioid prescription drugs are being poured out into our communities. In addition, what I want to highlight is that this is addressing one root cause. You heard it from multiple of our speakers. There's a number of tools that we must continue to bring to bear in terms of this fight. When we talk about prevention, when we talk about treatment, when we talk about counseling, as well as the number of law enforcement efforts outside of narcotics trafficking, when we talk about combating violent crime and gang activity. So my view is this: we are happy to be here. It's important that we are here. We are marshaling more resources, but frankly, we are amplifying the fight that has been long underway here in this region.
Are there any additional questions?
Amy Cadino, WMUR.
Yes, Amy.
Questions.
Yes, Amy. Good to see you.
How will success be measured?
Success will be measured by fewer lives lost. It will be measured by the number of opioid pills that we avoid being poured out into these states. It will be measured in fewer lives that are addicted to opioids. We've seen the success of this model. As I mentioned, we have a number of localized strike forces across this country, but in particular, when we talk about the ARPO strike force, we know that that strike force has resulted in decreases in all of those metrics.
Second part to the question. Why was it important to do such a big public announcement? Why not just set about doing the work of dismantling fraudulent pill mills and dirty doctors and let us know after the fact? Why this?
Yeah, it's a great question. I think this is we could have very easily done this in Washington, D.C., for example. I think it was important for us to be here in this community making this announcement. It's important for us to reflect our commitment from the Department of Justice and from our collective law enforcement partners to this community, to this region. And it's important for us to start messaging to the public that we are here as a resource, but also start making it clear to those rogue medical professionals that there is now increased effort, more focus on their criminal activity. And so there's significant deterrent value from us making this message here in this community today.
One last question?
Mark chronic pain, he suffers from chronic pain. They maybe have been on low doses of opioid for years, and now they're worried their doctor is going to say, you know what, you say it's not a gray area, but sometimes that happens, and I'm just not going to take the risk. And the person, do you worry you might be driving a chronic pain person to illegal drugs?
Listen, I know it's not a gray area. I know the types of cases and the types of defendants that we go after. We are all, and you've heard it from our speakers here, we are all very sensitive to the fact that there are medical professionals in our lives personally that we know and in our communities that are very dedicated to their craft, who uphold their oath to do no harm on a daily basis. The message has to be clear, and I'm happy to do so over and over again, that we welcome those law-abiding medical professionals as partners. We welcome their insight, we welcome their guidance. And frankly, what I hear from medical professionals is the same thing I hear from any other profession when we prosecute someone in that area. They want the bad apples out of their profession as well.